Hey guys, welcome to your channel Dr. Batisi. I'm your dentist, Dr. Jasmine. This video is really special for all the dentists and all the dental healthcare professionals because we guys are mostly in and around saliva, blood, inhalation of the infected droplets through nose, and because of these three, most of the infections are rapidly spread and highly contagious diseases are we can acquire it very easily. So there are few vaccines. I will be discussing about naming the 6 most important vaccinations that a dentist must and should get it done, of which the first one is hepatitis B. Hepatitis B, as you guys know, it's a life-threatening liver disease caused by HBV, and 98 to 100% of the protection is given by the vaccination, easily transmitted through the bodily fluids, such as a pregnant woman can give it to a child, through tattoos, piercings, use of razors, using each other's razors or the toothbrushes or the needles and the circumcision procedures, and of course through sex. Person having hepatitis B starts getting yellowish, start getting jaundice, maybe it's his eyes or maybe it's the skin appearance, it's fever, fatigue, muscle pain or the joint pain, loss of appetite, stomach pain, and also dark tea colored urine. What happens is, if we have not got the hepatitis B vaccination done earlier, there are 3 doses for it, which is given at 0, 1 and 6 months. And this is the 3 dose vaccination. It's like given intramuscular. In our college, there was this vaccination happening, but however, earlier before that, in my apartments where I live, there was a vaccination, so already got that done, and the booster dose also. It's very, very important because hepatitis is the most commonly spread and is most dangerous among our profession. The second is, guys, MMR, measles, mumps, and rubella. Again, and viral infection, inhalation through, the contaminated droplets of the patient, of the infected patient. Risk is really, really very high if we are not vaccinated to this. Especially common, very common among the travelers. In measles, there is, guys, cough, eye irritation. You can also see white lesions in the mouth, runny nose, and spreading of a rash. Mumps has both your salivary glands swelled up both the sides, fever, headache, weakness, loss of appetite. Rubella has rashes, generalized swollen glands, joint pain, fever, eye irritation. So guys, people who are born in 1957 or later gets 2 doses of MMR, that is at a gap of 4 weeks apart. If one dose is given today, then the another will be given after 4 weeks. If not prior you are vaccinated in your childhood or any point of time, you will get 2 doses of it. It is given subcutaneously. Third is, guys, the whooping cough, also known as pertussis, tetanus and diphtheria. Whooping cough, as the sound says, whooping. So when after the cough we try to breathe, there is a sound of the whoop, and it's like starts with a normal chord and gets really severe and causes breathing problem also. Tetanus, as you know, it's very common. We get the tetanus injections whenever we get a cut because the microorganism enters through our body through the cut or the wound. It attacks the brain and the nervous system, causing extremely painful muscle spasm, and if there is spasm of the jaw, it can lead to lockjaw. Diphtheria, a very contagious disease, attacks your heart and nerve muscles, makes you very difficult to breathe. The vaccine for PTD is given IM. 1 dose is given who hasn't received it, and there is 1 dose given to every pregnant healthcare professional with every and each pregnancy. And then there is a booster dose after every 10 years. The fourth one is, guys, very common, varicella, chickenpox. About the symptoms, I don't need to mention it. We are very familiar with them. The vaccine is given subcutaneous. If there are no previous vaccination happened or there is no proof of serological proof of immunity or verification of history of varicella vaccine or herpes zoster, that is shingles, then 2 doses are given, that is 4 week apart. It's like the same of the MMR. The fifth one is, guys, influenza, very commonly known as flu. One dose is given annually. There are basically two type of doses. One is activated, another is non-activated or the inactivated. And the activated one is also known as live, that is live attenuated influenza vaccine, LAIV. And जो inactivated है, that is given to especially people who are in contact with severely immunocompromised patients, like stem cell transplant recipients, and who are basically in protective isolation. Inactivated is given in intramuscular, and the live one is given intranasally, and the live one is given to non-pregnant women and only who are 49 years and younger. And guys, the last one is TB, the BCG TB vaccine. We all have marks here on the mainly left upper arm, so that is because of the TB, and usually smallpox leaves a mark, the vaccine leaves a mark. So we are mostly got the vaccination for TB. And the best part of these vaccinations is, like, mainly all the vaccines are given to us in the childhood, but we must know what is given and what not, because especially hepatitis and TB are something which are highly infectious. And whenever you work on at such a large scale, when you're dealing with so many patients at a time, make sure your stomach is full with the healthy food. You have your breakfast, maybe it's fruits, dry fruits, or something good and healthy, because it helps to build the immunity and fight infections. There is no point of having a samosa in a government hospital, which most of us usually do, because it lowers the immunity, and at the end, of course, we are there and working, and it's just increasing our body sizes. So make sure you eat healthy food and stay fit, stay healthy. These were the basic vaccinations that we all must do and must be aware as a dentist and as a healthcare professional. So this was all about it, guys. Stay safe, stay healthy. See you in another video. This is Batisi signing off. Bye.